morning, everyone. Welcome to the first of three series in the Exploring Specialties in Medicine series that's being put on. It's wonderful to have you all here joining us. My name is LaVigne. I'm one of the chief residents in radiation oncology at Johns Hopkins. And it's a pleasure to be helping out as moderator this evening. I'm here with three wonderful panelists, Kyle, Eric, and Derrick, who's going to be also sharing their thoughts and perspectives throughout the evening. And we hope to make this a very interactive session as well, sharing our stories, but also welcoming any questions or comments that any of you have throughout the evening. Before we get started, I did want to first give a big thank you to Dr. Maynard for helping to organize this. And then also direct everyone's attention to a couple of key links that I have shown up here, both the LinkedIn as well as the YouTube channel. These are great ways to stay up to date on everything that's going on with the program and for future sessions and opportunities to get involved. So definitely bookmark those for future use. But with that, I think we'll get started. I'll keep my portion on the briefer side because I do want to make sure that you all have a chance to hear from each of our panelists. But again, I'm just at the tail end of my training in radiation oncology. How did I find myself there? Well, just ever so briefly, I grew up in a small town outside of Boston, Massachusetts. My dad is a house painter and my mom's a landscape architect. And so I think from a young age, I grew to have an appreciation for art in various forms. And that perhaps lends itself well to now my career in something that's a very visual and visual spatial field. I think I always found myself drawn to medicine and to science in general. I stayed in the Boston area for my undergraduate career, and I did pursue science as a major, but I did a minor in studio art, again, tying back into the artistic theme. I knew I wanted to go into medicine upon graduation, but I also thought that I had a rare opportunity to perhaps see more of the world, to do some things outside of medicine that I thought might lend me some perspective in becoming a future doctor. And so I did a couple of very non-medical related things in that time period. I'm happy to speak more to that at any point tonight if folks have questions. But after 2 years, I found myself here at Hopkins for medical school, and really loved my time here and our patients here in Baltimore. And that ultimately led me to really want to stay for residency. And there's many reasons why I ended up choosing radiation oncology as a field. Again, happy to go into that more tonight, but that's just sort of an overview of how I found myself here in February 2023. With that, I would love to turn it over though to our panelists to give them some time to share their stories with you. First up, maybe we'll go right away left to right. Eric, would you like to take the floor?
Yes, I would be happy to. Thank you so much. Thank you, Dr. Maynard, for inviting me to this session as well. And so I'll talk a little bit first about myself and my specialty. So like our moderator, I also grew up in a very small town. The name of the town is actually 96, like the number. And it's in the upstate portion of South Carolina, pretty rural. And I think we had about 2,000 people in my hometown, 100 people in my graduating high school class. What really got me interested in medicine from an early age was actually my mom and her career. So she was a licensed practical nurse up until when I was in middle school, and she decided that she was going to go for her RN. And I was able to witness her studying. I was fascinated by the conditions that she was studying, seeing her medical textbooks. And I think at that point, I decided that I wanted to go into medicine and particularly become a doctor. And although I was in a rural location, there were opportunities to gain exposure to medical fields. And one of those was with the Area Health Education Consortium, which is located pretty broadly. There's also AHEC here in Maryland, for instance. But through that organization, I was able to participate in seminars and shadowing experiences that helped me to go into medicine, or at least set me on the pathway to go into medicine. And then I continued that in college through various volunteer activities. So I currently am an allergist and immunologist. And I will say that I did not foresee myself going into this particular branch of medicine. I grew up with allergies, like a lot of people, and I actually had these random episodes of hives, starting when I was in college, that had sort of continued to today. And really, when I was in residency, I started to think more about my own condition, see patients who suffered from similar conditions, and I wanted to answer the question of why is happening, and that's really why I decided to go into research and into allergy-immunology. So allergies are pretty common. And what an allergist immunologist does is we actually diagnose, treat, and manage patients with common allergic conditions such as allergies, asthma, food allergies, eczema, anaphylaxis, and even more rare conditions such as immunodeficiencies. And immunodeficiencies can be either primary or acquired. HIV is an example of an acquired immunodeficiency. But what we focus on are the primary immunodeficiencies, some of which have a known genetic basis, and present in various ways, which can be recurrent pneumonias, recurrent sinus infections, recurrent herpes infections, so all different types of infections. And some of them can also be associated with autoimmune conditions. So that's what I mainly deal with my specialty. And so I went to college at Duke, and like I said, I had some shadowing exposure to medicine, and I decided I would return home to South Carolina for medical school. And at that moment, most of my experiences had been in shadowing individuals in primary care, particularly family medicine. And so I thought that's what I wanted to do. That was really what I knew the most about. But it was in medical school that I got some research experience working with an allergist and learning more about the immune system during my first year that led me to become more interested in immunology. And so I considered primarily fields that involved a lot of immunology, although I hadn't quite settled on allergy until I was in residency. And so in residency, so I did my residency at Ohio State, and there are several ways to become an allergist. You can do a residency in internal medicine, which is 3 years, and focuses on the treatment of adults for a variety of medical conditions. You can, I agree, go Ohio State. You can also become a pediatrician or do a pediatrics residency where you're focusing on patients on the age up to 18, birth to 18. Or you can do like I did, do a combined residency in internal medicine and pediatrics. So with that residency, they take 6 years. If you were to add up an internal medicine residency, which is 3 years, and pediatrics, which is 3 years. So they take a 6-year residency or residency experience and cram it down into 4 years. So I did that, and then I went into allergy. And so, like I said, there, any of those 3 ways to get into the field, but our field does require training in adults and kids. So if you happen to, go into pediatrics and become a pediatrician, you can still be an allergist that sees patients of all ages. And our subspecialty is one of the few where you can do that. And then so, let's see, I guess I should probably talk a little bit about the challenges that I've faced. I think there have been a couple of adjustment periods that I'm sure many of the other speakers that you will hear from can attest to. But my main adjustment period came my freshman year of undergrad. And I thought in high school, I knew how to study. And it wasn't until freshman year, and particularly sophomore year, that I learned that I really didn't have any clue. And, as a result, some of my grades were not the best. They weren't what I was accustomed to getting in high school. So it took a while to sort of learn how to study. And I thought by the time I finished college, I had it down packed, and then came medical school. And so that was another adjustment that I had to make. With medical school, there's a ton of information that's being thrown at you all at once. I think, you know, those were pretty much the main challenges that I faced along my journey. I think having supportive mentors that you can identify with, having good role models who you can also turn to and ask for advice, helped me to face those challenges and kept me from having anything else happen, I would say. Um, in terms of the pros and cons of my specialty, I enjoy what I do a lot. So as I mentioned before, I do research and I see patients in clinics. So most of my time is spent on research, working in the lab. I do research that involves human skin cells and immune cells that are in the blood, and is really designed to try to understand the mechanisms for why we have certain conditions, why certain people may develop hives or have anaphylaxis. And so that's what I spend most of my time doing, probably about 75% of my time. And then I do see patients in the clinic of all ages and all conditions, again, which I enjoy. And then also I do some teaching for the med school. So the main thing that I guess I would say is a criticism or a con potentially of my specialty is that unfortunately a lot of people don't know a lot about allergy. Allergy and immunology aren't required training as part of internal medicine or pediatrics, for instance. And many individuals don't have a lot of exposure to it, as they're progressing through the medical training. And so what we end up facing in clinic are patients who have been mismanaged or misdiagnosed. And there's a lot of education that we have to do on part of both patients and the provider, which I enjoy. And I think, I'm glad that we're able to make an impact on providers and patients, but it sometimes makes me wonder, the patients that we're not seeing or the providers that we're not having contact with, that there could be potentially still some mismanagement and miscommunication. But I would say that's probably the downside about my subspecialty, is that not a lot of people know about it. A lot of people think that they do, but they may not. And I think that covers most of what I thought I would talk about. So again, thank you for having me here, and I'll be happy to answer any questions at the end.
Eric, thanks so much for sharing that. It's really great to learn more about, again, what brought you here today and got you into the field. And thank you for sharing your perspective. I think maybe we'll just continue with hearing from our panelists, and then at the end we can open it up to questions. Derrick, are you ready to go next? I do have your slides pulled up. I'm happy to advance them for you, or if you'd prefer to share on your end, whatever's easiest.
It's probably fine to share on my end. I'd
Okay,
can certainly do that.
Here, I'll stop. There you go.
Let's see. And is my screen shared?
I haven't seen it yet.
Yeah, no.
Let's see. Okay. All right. Can you see my screen now?
Yes.
Okay, good. Yeah, I'm Derrick Fox. I'm a neurologist and a focus on neuromuscular medicine. I'm fellowship trained. I'm actually the director of neuromuscular medicine for MedStar Health, Baltimore region. So happy to be here, and definitely appreciate you, Dr. Maynard, for inviting me. It's certainly a pleasure to be here and talk about my experiences. So I'll just dive right into it. I had the benefit of some extra time because I'm actually off this week, just at home doing a staycation. So I'm gonna proceed forward with my slides. So a little about me, I'm actually from the Baltimore area. I was born and raised in Baltimore and around Baltimore. Grew up in Columbia, went to school in Baltimore and Columbia. So I actually decided to become a doctor when I was about 8 years old. So my mother was a elementary school teacher in Baltimore City. My father was an accountant. And I have a picture, obviously, of myself with my brother and my mom, and that's another picture of me and my older brother, basically. But we were a loving family. Unfortunately, my parents did split up when I was about 4 or 5 years old. So, I mean, that was probably, as far as my early stages, the most adversity I faced, but I was fortunate to still have both my parents in the area and have access to both my parents growing up. As far as college, I knew pretty early on that I wanted to go to Howard University, so go HU. But I knew probably around when I was in 10th grade that I wanted to go to the Mecca, essentially. One is because I made the decision I wanted to go to historically Black college university. And the other is because I wanted to go to a place that I knew would very well prepare me to go into medical school. So I actually started at Howard University back in the fall of 2000. I was a biology major, like many pre-medical students are in a chemistry minor. I was in a program called the pre-professional program that was obviously designed for college students that were going into medical field or dentistry field or even law school and graduate studies as well. As far as adversity I faced, I went to school for my first 2 years at Howard, and I, like Eric, went through a little bit of adversity with regards to grades. Did okay, but not great, not as well as I was used to doing in high school. So because of that, I actually lost a scholarship and I had to withdraw completely in 2002. So that allowed me a good period of time. It probably took me a little over 3 years to get back into school. And during that time period, I actually worked 2 full-time jobs for this time. And one of the things that I really took back from that experience when I returned to school in January 2006 was I really started to appreciate the value of time. If you would have asked me when I was in my freshman and sophomore year of college, I would have told you, I study hard, I work hard. And when I went back, I had the benefit of talking with one of my mentors who told me about, he was really able to quantify how much you need to study for when you're in your college courses. So when I worked 2 full-time jobs, I really understood time a lot more. So I realized that I can, be spending more time studying. And my mentor basically told me that you need to study about 3 hours for every credit that you're taking. So that means if you're taking 16 hours worth of credits, you need to be studying about 48 hours every week. And that's outside of actually going to your classes. So once I actually instituted his principle of spending that amount of time on my college coursework, obviously I began doing much, much better. And then also the other thing that I had the benefit of was my roommate, my best friend from college, was in dental school at that time. So watching him progress from his undergraduate studies to being in dental school and closing out the health science library every night and studying, as much as he could, I began to realize, well, this is exactly what I need to be doing if I'm trying to, go into medical school a year or 2 from now. So I basically did the exact same thing. I just learned to work really hard. And I ended up graduating in December 2007, went on to medical school, did very well. By the time I went to medical school, it was an adjustment, but it wasn't as much of an adjustment, only because I really had been able to hone my work ethic. And I just essentially continued what I was doing my last 2 years of undergrad with studying essentially at that pace. So I ended up graduating in 2012. I had several very interesting and wonderful research experiences. One was at the University of Wisconsin in Madison summer research program, where I was able to work with some top-notch scientists in the agriculture department at University of Wisconsin. Another was being a mentor for a program called SMDEP that is essentially designed to help pre-med and pre-dental students in their college coursework and prepare them for medical dental school as well. And then the last of which was probably the most informative towards me going into my career specialty as a neurologist, was a postdoc fellowship at NIH, which I did actually right after my medical school experience. And I got a chance to work with patients with a very rare disease called Kennedy's disease, but it's basically a disease of insidious onset where they have significant weakness, atrophy, muscle loss, essentially, and other disturbing changes in their speech and their ability to swallow. And it very much can look like ALS and be misdiagnosed for ALS. But either way, from that clinical and that research experience, I became very interested in neurology as a field, how comprehensive the neurology examination is, how much time you spend with your patients, and even the types of patients that I was seeing. I was, usually seeing very hardworking people that was essentially coming down with symptoms that, they would usually explain to maybe getting a little older. So that was something that I really appreciated. And I think that probably most firmly cemented my interest in going into neurology. So as far as my neurology training, I actually did an internal medicine prelim training at ECU in Greenville, North Carolina. And then I went on to my neurology residency at Howard University, my alma mater, where I did, fairly well. I was able to score very well on the in-training exam, or the standardized exams that we take every year. Went on to become chief resident and present multiple posters and case discussions at several conferences throughout the year. So I actually had a very good experience during residency training, but I'm sure any of the doctors on this panel will let you know that when you go into residency training, you're going to work really hard. So I then went on to do a neuromuscular EMG fellowship at Duke University in Durham, North Carolina, which once again, I enjoyed that experience very much. It's a one-year fellowship, but it's very different from neurology residency. When you're in residency training, you're mostly seeing patients that are in the hospital, patients that are admitted for a stroke, patients that are admitted for a multiple sclerosis exacerbation, patients that are admitted for a spinal cord injury. You do have some continuity clinic, which is essentially what we call it. So you have a little bit of clinic or outpatient experience, but it's not as much as when you get out into the real world after you finish your training. So during this fellowship, we got a chance to focus on patients, particularly with nerve and with muscle disorders. Okay, and I got a chance to work in various neuromuscular clinics, ALS clinic, the muscular dystrophy clinic, myasthenia gravis clinic, and obviously working in an EMG lab. And EMG is a unique procedure where you're essentially using electricity to test the integrity of the muscle and the nerve function. So part one, the nerve conduction study, you're giving a patient minor electrical zaps to see how well the nerve responses come up. And then part two is you're inserting a small, almost an acupuncture sized needle directly into a targeted muscle to see and hear the electrical activity. So it's a very useful test as far as figuring out causes of weakness, especially after a stroke has been ruled out, especially after a spinal cord injury has been ruled out. So after I finished my training in 2019, I took a job in Central Illinois, and I stayed there for 3 years, had a great experience, and I got a chance to work at an ALS clinic during my time there. And actually recently, I actually just moved back home last year with my family. And I'll talk about my current role now, but I want to just take some time to talk about the field of neurology and kind of explain what a neurologist does and what types of disorders that a neurologist focuses on. One of the most common questions I get is, well, are you a brain surgeon? And the answer is no, I am not a brain surgeon. I do not do surgery at all. So very often patients really don't understand what a neurologist does. A neurologist is a medical doctor that focuses on dysfunction of the brain, of the spinal cord, of peripheral nerve elements. So essentially, you're seeing patients usually for one of several major reasons. It could be because they had an acute stroke. It could be because they had a bleed inside the brain or an intracranial hemorrhage. It could be because of the onset of nerve disease or peripheral neuropathy. It could be because of a central demyelinating disorder, such as multiple sclerosis, which can present with very vague neurological complaints. It could be because of muscular dystrophy, which is usually an inherited disorder where the muscle, the proteins of the skeletal structure of the muscle basically start to degenerate and get weaker and weaker over time. It can be because of Parkinson's disease, which is a movement disorder. And it can also be from a disorder probably a lot of people know about from the social media challenge, the ALS challenge, or amyotrophic lateral sclerosis, which is unfortunately a terminal disease and more people know about now. So I chose neurology mostly because I was very fascinated by the power of the human brain. And what I was fascinated about it with, probably the first time I really got interested in neurology was during my third year of medical school. And for those of you that are interested in medicine, your first 2 years are going to be focused really on the preclinical sciences. Usually the first year is focusing on how the human body works normally. And then second year is usually going to be focused on how the human body works when disease starts to become involved. So usually you're learning more about pathology in your second year. And then your third and fourth years are usually your clinical years. So on one of my clinical rotations, I saw a patient with Parkinson's disease that had a resting tremor that he was not able to control. And I became very interested in that. And then once I actually saw him start on treatment for it, we saw almost an immediate improvement in the tremor. And obviously an improvement in his quality of life. So you get a chance to see interesting cases. You also get a chance to have a lot of interaction with people as a neurologist, particularly your patients, but also your colleagues and staff and other people that you work with. And also, like I mentioned before, one of the things that I really love about neurology is how detailed the examination is. But I have to admit that is something that's probably a little suited towards me because some people may not like, spending 15 minutes doing an examination. So that is something that probably separates neurologists maybe from some other specialists or from some other clinicians. The other thing I really liked about neurology was the opportunity for growth in the field. So as far as my subspecialty, neuromuscular medicine and EMG, it's, like I said, a subspecialty in neurology that really focuses on nerve and muscle disorders. So when you become a specialist, you're really, in some cases, you're only seeing people with these types of presentations. So very often when I see patients, I'm seeing patients that are coming in for a complaint of weakness. It could be weakness all over the body. It could be weakness in a focal area, like noticing foot drop, noticing hand weakness. It could be tingling and numbness that they're noticing. It could be balance problems. It could be even muscle loss or weight loss, vision changes, or even a problem with speech or swallowing. So these are probably the most often complaints that I will usually see people for, or patients are referred to me after seeing another specialist. And one of the things that I think there's great hope and great optimism for in neurology is the opportunity for treatment. And kind of going along with Eric's point, immunology is really a field of medicine that I think is really ever expanding, especially over the last couple of decades. So immune therapy treatment has really allowed a tremendous potential for us to be able to treat diseases, especially diseases that are autoimmune or have some immunological component. So it's because of all the advances that are being made, there's a lot of effort and research that are going into that. And I think the future is going to be very bright. One of the things that I have realized is that the earlier you come to a diagnosis, a proper diagnosis, and the earlier you start treatment, this usually allows for a much better outcome. So on the right, I have a picture of a patient that's actually going through IV immunoglobulin infusion for CIDP, or Guillain-Barré syndrome, And Guillain-Barré syndrome is an acute onset of a rapidly progressive neuropathy. On the left, I just have a picture of a patient working in a stroke recovery rehabilitation clinic. So you get a chance to see patients in a kind of a wide variety of different areas as they go through rehab treatment, physical therapy treatment, speech therapy treatment, as they go through their infusion treatment, and you get a chance to see how they're doing, and hopefully you get a chance to see that they're improving over time. So now I'm going to go to my current role. So at this point in time, I'm actually the head of neuromuscular medicine for MedStar Health in the Baltimore region, and I'm primarily based at Franklin Square Medical Center in Rosedale, Maryland. So I am triple board certified in neurology, neuromuscular medicine, and EMG. And as far as I know, I'm the first African-American male to accomplish this feat. So I'm also the EMG lab director at Franklin Square Medical Center, and I'm an assistant professor at Georgetown University, and I have an opportunity to work with the residents and the fellows there at Georgetown. I have an opportunity to collaborate with the ALS Association, and we're actually in the works or working towards bringing an ALS clinic to Franklin Square Medical Center, hopefully within the next year. And then something else I do is I work with a couple of different advisory boards in the biopharmaceutical industry for neuromuscular disorders. And like I talked about earlier, there's a lot of different treatments that are coming out for autoimmune disorders such as myasthenia gravis, such as CIDP. So, I think the future is very bright. And second to last, I want to talk about, the importance of my family. As you go through this process, this journey, it's important to have people that love you and care about me. So you see in the top right, I have my wife and my daughter who been, a huge, tremendous support system for me. I have a picture on the bottom left with my oldest daughter, and then at the top here, I have a picture with my family and my mom and my dad and other surrounding family. So I'm only including this slide because I just want to let you know, as you go through this journey, when you have a strong family support system, it's going to make the journey a lot easier. And as I said, you want to be able to appreciate the moments through time. You don't want to be a person that goes through this and you hate what you're doing. Usually you're going to do better in things when you appreciate what you're doing. So whether it's medical school and studying, whether it's residency training, if you're the one that always hates being on call, it's going to be hard for you to learn. But if you're someone that you go into your call shift and you appreciate, what am I going to learn today? What am I going to take home from this experience today? You're going to become a better clinician and a better physician. So just a couple of take-home messages. I always think it's better to decide early on in your life, what you want to do. If you're able to decide early on what you want to do, you're going to have more time. You're going to have a longer ramp to become successful at it. Number two, I want you to realize the importance of working hard and valuing your time. Like I said earlier, I was out of school for almost 4 years before I returned to school. And when I returned to school, I was a much better student. So I had honed my discipline. I had honed my work ethic. I understood how important time was, and I was able to become a much better student and demonstrate what I learned, whether it's on examinations or standardized exams or even in any type of assessment. You're always going to be able to do better when you spend more time and invest that time early on. I also think it's important to stay committed. You're going to come to some points where you face some adversity, and that's just life. So actually when I took my board exam, I don't think I slept just because I was so anxious the night before. So I had to go in and take my board exam on very little sleep, and my daughter was not even a year old at the time. So you're going to run into hurdles. Hurdles are a natural part of your life, but you don't want those hurdles to be an excuse for not accomplishing something. So you don't want to give yourself that out clause that, well, I didn't accomplish this because of this. So always stay determined. Believe in yourself. Like I said earlier, appreciate the journey. Surround yourself with good people. That's why I talked about my family a little earlier. And then lastly, one of the most important points is to know yourself, know who you are as a person, trust your instincts, know what's going to make you happy, know what you're going to be able to see yourself doing and what you can do well at. So those are the things that, I really wanted to demonstrate and convey to you all. And hopefully you found this to be helpful. And, once again, I can go over any questions, but we can save that towards the end of the talk.
Derrick, thanks so much for that overview and for the great photos, particularly of your family. Your passion for neurology is unmistakable in the way that you speak about it, and I very much appreciated your willingness to share that getting to where we are and pursuing a career in medicine is hard at times. And I think if you ask any of us here, speaking tonight, there are detours and roadblocks that we often don't speak about, but in so many ways have shaped us into the physicians that we've become. And so thank you for shedding light on that fact.
Thank you.
Kyle, would you like to take the stage next?
Yeah, sure thing. And man, this is quite a panel. Dr. Fox, Dr. Oliver, Dr. Maynard, thank you for organizing all of this. And it's nice to see everyone who's in attendance. I definitely remember being in your shoes very recently, and I definitely aspire to be in the shoes of people like Dr. Fox and Dr. Oliver in the future. But yeah, my name is Kyle. I am currently in my final year of residency at Johns Hopkins in the emergency medicine residency, and next year I'll be moving on to work at Kaiser. I grew up in St. Louis, Missouri, grew up in the city, and then ended up moving to the suburbs, which is surrounding this Scott Air Force Base right outside of St. Louis City in O'Fallon, Illinois. Loved my childhood, loved my upbringing, got exposed to a lot of people from a lot of different backgrounds, being close to the military base. And my original inspiration with getting into healthcare was actually through a mentor, Dr. James Whittico, who was, believe it or not, a 97-year-old practicing family medicine physician. Just like Dr. Oliver was saying, that's how a lot of us get introduced to medicine. And it was really nice being able to just shadow him going slowly from patient room to patient room and seeing how much attention to detail he paid for his patient care. And up to that point, I had wanted to impact the community in some way through either like community advocacy, community development. But yeah, that definitely opened my eyes to the opportunity to try to impact the community through healthcare. I went on to Howard University, following in Dr. Fox's footsteps for undergrad. Dr. Maynard too, you went to Howard? Oh my God, how did I miss that? Okay. So I went to Howard, and I chose to go to Howard among other different options because, I mean, after going on this senator-sponsored Black College tour, it was clear to me that I would definitely get the family environment that I wanted to maintain after leaving high school. I knew that being in DC, there were going to be a lot of medical conferences going on, and the medical school and the dental school are right on campus. So I knew that I would be able to do some research as soon as I started. And Howard University had a huge reputation in pre-professional advancement, whether it's through like Dr. Fox was saying, like pre-law, pre-business, and then definitely pre-dentistry and pre-med. And as soon as I got there, started working hard, tried to hit the ground running. But there was always that sense in the back of my head that I imagine a lot of you all and participants who are here might think right now at the stage you are in, which is like, am I getting the same education? Am I getting the same preparation? Am I going to be considered in as high regards as my peers at different institutions, probably at these Ivy League institutions, probably at these institutions where I am a drop in the bucket instead of, what might be perceived to be one of the many. And the summer after my freshman year, I went to UCLA through SMDEP, the Summer Medical and Dental Education Program that Dr. Fox mentored. And it was really nice to see that if you put in the hard work, no matter what institution you're coming from, you can not only hold your own, but you could thrive in whatever group you're in, whatever setting you're in. Just put your head down and go to work. It's the beauty of doing programs in pre-medicine programs and doing like summer research programs is that you start to view other people not as competition, but you start to realize that there are very similar, aspiring, like-minded people who you'll be able to go through the journey with. So everyone who's in attendance today, I want you all to look at each other as people you can lean on through this journey. It is a long journey, but it's really nice to know that people are going on the journey with you, even if you all end up in different places. I spent my second summer doing research at Brigham and Women's Hospital in Boston, Massachusetts, and that was, again, one of those situations where you could feel as if you don't belong there, but if you just put your head down and get to work, you realize that not only do you belong, but you're desired. So it was at that moment that I realized that, you know, I could hang with the best of them. I could do my thing, and yeah, if you just put in the work, then you could focus on the things that actually interest you instead of just trying to you know, stay above water. And that's when things get really exciting, is when you focus on the right things, which is just like, this is your one chance to gain insight from experts. This is your one chance to use resources that are afforded to you and could have been afforded to anybody. Probably should have been afforded to people that, you know, that have same intelligence as you, who just didn't have the same opportunity as you. So definitely take advantage. And then my junior year, I did a fellowship at University of Oxford and studied biochemistry out there. And did some for the academic year. Came back to Howard and applied to med school and ended up going to Harvard Med School straight through. Spent 4 years at Harvard Med School and then 1 year at Harvard School of Public Policy, because there was a time when I was leading this the student-run clinic at Harvard where we were surprisingly having a lot of autonomy and doing patient care, and I realized that a lot of the patients that we encountered needed more than just healthcare assistance. They needed social services that they couldn't get connected to. There were so many what you hear as like social determinants of health. There were so many socioeconomic factors that play into the healthcare that you're able to provide somebody that you're not able to impact as just a physician or a dentist or any kind of healthcare provider. So that's what made me want to get some policy training. And that was a great experience, not only for the education, but also in meeting my wife. And then came to Hopkins for residency, and I'm currently practicing emergency medicine. So as an emergency medicine provider, it is what a lot of you in attendance might think of when you hear about like medicine, just because the media and the TV shows have really, for one reason or another, for the excitement, for the chaos, chosen to focus on emergency medicine. And surprisingly, a lot of the shows are accurate. I only recently started watching them because, you know, just like all the physicians here, I was grinding. But it's surprisingly accurate, but there are a few key distinctions. The benefits of my field and the reason I went into emergency medicine is because, I mean, it's exciting. You are in a lot of cases are the first person in healthcare that somebody might encounter. You might be the only person in healthcare that somebody might encounter on any given day. You serve at the intersection between like public health, what's going on in the community, and the health that you're able to provide in the hospital. You're at that intersection. You're the gatekeeper in a lot of cases for somebody getting advanced care from the experts like Dr. Oliver, Dr. LaVigne, Dr. Fox. Like if you're a patient, you're not going to be able to see these specialists unless I'm able to identify that you need this expert care from the experts who are on this panel. And there is a wide range of acuity on any given day. I mean, especially being in Baltimore, unfortunately, like you'll see your car accidents. You'll have to care and provide immediate critical stabilization of gunshot wound victims, people who are in like severe distress in any other kind of a way. And you'll see like you'll see the hints of the myasthenia gravis picture. You'll see anaphylaxis and you'll realize, wait a minute, you need to see these experts who are on the panel. But then there are the downsides. You have a fluctuation in the timing of your shifts. You could work night shifts, day shifts, which is great for some people, but not for everyone. you don't have the continuity of patient care. You don't get to actually you don't have the continuity of patient care in the ideal situation. Unfortunately, you have your bounce backs who come back to the emergency department. In some cases, if you do your job right, in some cases if you don't. But there's the loss of continuity in patient care. You have a lot of unpredictability and what kind of patients you're going to be able to see. It's practice specific, it's location specific. But altogether, it's exciting. And I'm so excited for you all to get introduced to healthcare in the first place. Challenges with my journey, and I'll wrap up shortly. Similar to what Dr. Oliver said, I struggled with having to update my study habits at each different transition. I do not do well with transitions. It's really amazing how you'll learn so much during the course of any subject, any year, any different training program, and then you'll go to the next one and you'll realize, yes, that was important at that time, but I feel like I don't know anything about what I need to know. So learning how to learn, trying to figure out how you learn best is the most critical thing you could be doing right now. Whether you're a visual learner or you're an audio learner, like there are podcasts, there are YouTube videos, just find out what's the best for you. Transitions are difficult, but everyone has to deal with them. So be patient with yourself and realize that everyone was once in your shoes, no matter how impressive they look, no matter how seamless they make the healthcare practice look. Realize that at some point they were a novice, at some point they knew even less than you, because of course they did. They hadn't been practicing for as many years as they are now. So be patient with yourself, and then definitely, like Dr. Fox was saying, surround yourself with the right people. I have been fortunate to be surrounded by the right people in a lot of cases, but we're at the age where you have to select your immediate group, select the people that are going to motivate you, that are going to fill your cup, that are going to make sure that they're giving you grace so that you can know to give yourself some grace during this challenging process, which is such an exciting process. So with that, I'm happy to join everyone in fielding some questions.
Thank you for closing out what has been just a phenomenal